sensitive like us to take note of. A second thing is that the presentations and the recording of the session will be made available after today's session as well. So do look out in your email for the links later on. And lastly, please feel free to let us know who you are, where you're from, and your key areas of work in the chat box as well as we move through today's lesson. It's always good to know and to meet new people as well. So without further ado, let me turn the floor over to Jeff Acaba, Senior Program Officer of ACASO, to share with us some of the key outcomes from the Right to Breathe project. Jeff, over to you.
Sorry. Thank you so much, Jen, and hello again, everybody. It's so nice to see a lot of familiar names. And in an alternative universe, we may be doing this in person and chatting with each other in person. But let's make do with what we have. And one of the things that we're really proud of to present is the outcomes, the results and the outcomes of a year worth of efforts that we did under the Challenge Facility for Civil Society 9, which we titled Right to Breathe Project. The inspiration for the Right to Breathe Project actually started in 2019, again with the support from the Stop TB Partnership in partnership with the Activists Coalition of TB Asia Pacific, or ACTP, when we developed this training manual specifically to empower TB-affected communities and civil society working on tuberculosis with regards to human rights and in order to promote rights-based approaches. So that was really the starting point of how this Right to Breathe project has developed. In the development of this project, one of the things that we observed, especially during the 2018 political declaration on TB and during the high-level meeting on TB in 2018, is that while there are really strong targets and commitments that have been made at the highest level among UN member states, many of these commitments with regards to rights-based approaches and human rights, not to mention, of course, the gender sensitivity aspect approach and also community engagement, has not been clearly or clarified in terms of clear targets. The commitments are good, but in order to measure some of these targets and commitments, we really need something that we can actually look into and measure moving forward in order for us to really understand and to see the outcomes of such commitments from 2018 and moving towards the progresses every year. One of the things that we really focused on was on human rights and rights-based approaches. Eventually, in the following years, there have been increase in investments when it comes to promotion and implementation of rights-based approaches. For example, with the Stop TB Partnership to the Challenge Facility, the global funds breaking down barriers, and there have also been a lot of reports that have come up, including the Divide report, where we saw how the progress has been made with regards to the UN high-level commitments. With those researches and with those studies and initiatives, we saw that there still continues to be a gap and non-prioritization of human rights-related work with regards to tuberculosis. In particular, there has been limited opportunities and investments to focus on access to legal aid, promotion of rights-based approaches within the justice system, linkage of the TB program with the justice systems in the countries, and also empowering communities and building that awareness to understand how the connection is established between TB and human rights. So with those background, we did develop this Right to Breathe project. So with this, I'm going to present some key results over the 12-month course of the implementation of this project and highlight the outcomes and how those actually led to what we will be doing today. So the project has 3 objectives with an overall aim, which is to establish an Asia-Pacific human rights advocacy agenda and address human rights-related issues in TB. The project is not something new in terms of its overall goal, because we did recognize that a lot of work has already started around human rights and tuberculosis. What we're doing is actually consolidate all the work and all the efforts for Asia and the Pacific, and consolidate also the perspectives and priorities of TB-affected communities and civil society as we build their capacity and awareness on human rights in order to identify a set of priorities on an advocacy agenda for the Asia and the Pacific. How do we do this? We identified 3 objectives under this project. So the first objective is supporting civil society, TB-affected communities, and TB survivors in the rollout of the Right to Breathe training manual, human rights training manual for civil society and TB-affected communities, and support advocacy plans after that. Later, I'll share specific results and outcomes for each objective. The second objective under this project is to lead the development of a regional human rights advocacy agenda, because what we want for the development of this agenda is to make it grounded and also based on the realities and the felt needs of TB-affected communities and civil societies working in tuberculosis in the region. And then the third, of course, we don't want just to develop an advocacy agenda. We also wanted to promote and advocate so that this advocacy agenda, which you will see later, can influence and can be integrated into either the NTB strategy, into the regional work of our partners such as WHO and Stop TB Partnership, and other partners as well, including the Global Fund. And those 3 objectives are grounded in the 2018 political declaration on TB. So in terms of the results, under Objective 1, in late 2020, we were able to roll out a training of trainers program for Southeast Asian and South Asian-based civil society and TB-affected communities. So we did it over the course of 2 months with 3 sessions each. And we did translate the Right to Breathe, which was supposed to be a physical capacity building activity, into an online one in order to build a set of trainers who can actually roll out the human rights training manual at the country level. Again, the idea is to not simply build the capacity of civil society and TB-affected communities, but also make sure that the capacity that has been built is translated to national context. We invited among the 21 representatives and our partners from 3 countries, that's in Nepal, in Papua New Guinea, and also in Vietnam, to participate in the training of trainers. Because under the Objective 1, we aim to support and roll out the Right to Breathe training manual in these 3 countries and support succeeding advocacy-related activities, depending on how the communities will want to prioritize their activities. So with those seed funding support through this Right to Breathe project, we were able to roll out the Right to Breathe manual in these 3 countries, as you can see at the bottom part of the slide, where we do provincial level or sometimes national level training of the human rights training manual, but covering so many different around 10 districts in the country. So the first photo you'll see is in PNG, in one of the 3 provinces. The second photo was in Nepal, where they did a rollout of the training in 10 districts. With the third one, with SCDI, we're planning to do the same as well, and at the same time highlight the communications aspect of it. Because what the SCDI wants to do under this project is to jumpstart a public awareness about TB that will become the entry point for human rights discussions in the country. Okay, under Objective 2, as I mentioned earlier, we wanted to make the consultation towards the development of the advocacy agenda or the advocacy strategy to be more grounded and based on the priorities and perspectives of TB-affected communities and civil society. So what we did, as the 3 seed funding grants through our partners in the 3 countries that I mentioned are ongoing, we facilitated a regional level consultation, and around 45 community and civil society participants attended that consultation. The consultation was done in July, And in that consultation, we're able to identify key priorities that are aligned with commitments from the 2018 Political Declaration on TB. And a writing team was formed after that consultation. Now, the writing team, which is composed of 12 representatives and individuals from within the constituency of civil society and TB-affected communities, met twice to finalize and polish the advocacy strategy. And now you'll see on the screen the layout version of the advocacy strategy, of which we will also present after this, the contents and what the priority activities would be under this advocacy strategy. And then the third objective, of which what we are actually doing today, is the translation of the advocacy strategy into national roadmaps. One of the things that we envision as we complete some of the national levels support to the three partners, that we don't want just the activities to end and the outcomes to end once the grant ends. So we wanted to see how are they going to roll out some of the priorities at the national level. And we did ask them, of which they will present later on, a national roadmap wherein they consulted with national government partners and technical partners at the country level to see how they can influence and include some of the outcomes of the grants into the national TB response work. And okay, just very quickly, in terms of the key outcomes and learnings from this Right to Breathe project, the first one really is the building and the enhancing of the knowledge and capacity of TB-affected communities. It was really interesting, especially during the training of trainers and the feedback from the country level, that a lot of people working on TB and those who are affected by TB, including people living with HIV, say that they actually don't understand much about human rights or how to operationalize human rights in the context of TB. And this project, through the rollout, has really enabled them to understand the connection of human rights and how to promote rights-based approaches within the context of tuberculosis. As mentioned in Vietnam, it is expected that the general public awareness on TB will be scaled up. One of the findings in the rollout in Vietnam is that TB, the knowledge and awareness around tuberculosis only begins once a person who is infected with TB goes to the health facility. It is not as publicly aware as in other diseases, such as HIV or COVID-19. So that is really something that we're looking forward to get to the activities in Vietnam and how they will roll it out. Another key outcome from this project is that open communication between the government and the TB-affected communities. This has been the case with Nepal and Papua New Guinea, wherein they said that because of the project, they were able to facilitate and introduce not only human rights in the context of TB, but introduce TB-affected communities themselves and how they can start the dialogue and feedback mechanism in order to close that loop of improving the TB response and ensuring that the rights of TB-affected communities are prioritized as they roll out the TB programs at the country level, especially at the provincial level and district level, in the case of Nepal and Papua New Guinea. The next point in terms of outcome is that communities understand the value of community-led monitoring, and not just the digitized ones, but also working through paper-based monitoring. And that's something that's being done in Papua New Guinea at the moment. From Leslie might confirm this later from the KP Advocacy Consortium, but they're now gathering data from the paper-based monitoring, and that will enable them to continue that dialogue at the health facility level to improve the TB response. And last but not the least, the outcomes and the learnings from this project has been used to mobilize communities towards a shared goal and also influence ongoing grants and ongoing programs at the country level, one of which was during the Global Fund funding requests in Nepal. And so with as mentioned, one of the activities or key activities of this grant is the development of the advocacy strategy. And after this, I would like to call on Priyanka Iyer from GCTA, who has been nominated or has volunteered to present the advocacy strategy on behalf of the civil society writing team. And she will walk us through on what has been the different objectives of the advocacy strategy at the regional level moving forward from here. So over to you, Priyanka, and let me project the presentation. Thanks.
Thank you so much, Jeff. Most of you know me as Priyanka from GCTA, but today I'm wearing two hats. As Jeff rightly mentioned, I am also representing the writing team. So first and foremost, I must thank all my writing team members for their time in making this advocacy strategy possible. So right at the beginning, let me walk you through the process that we undertook to create this advocacy strategy document. Next slide, please, Jeff. Thank you. So on 29 July, we met as a big group and we decided that we would need a focused writing team. A few of us volunteered and the writing team was formed. The 16th August meeting was more honed in and we decided what our overall goal should be, what the objectives should be, and how we can align them to the UNHLM commitments. 25th August, we took another deep dive, and this time we were talking about the challenges and the steps that we need to take in order to be able to fulfill the objectives that we have set for ourselves. And that brings us to today, and we're really, really proud to present this advocacy strategy document in front of you. We have 4 objectives, so I will quickly walk you through all the 4 objectives, but first, the goal. Next slide, please. The goal is to transform towards a more rights-based TB response in Asia Pacific with TB-affected communities at the center. Our first objective is, Jeff, next slide, to increase knowledge and awareness of TB-affected communities, both in TB infection and disease, as well as on entitlements and human rights. You will see that each objective is aligned or reads from a specific paragraph from the UN high-level commitments. I'm not going to deep dive into that, but going directly onto the steps and initiatives that we have charted for ourselves. There is an immense hunger in the community. Policy documents and guidelines are great, but what we need is information that is simple, actionable, and community friendly, something that is by the community and tools that have community at its heart. And hence, we need to enhance effective public communication among people affected by TB, about TB, as well as their rights. We also want to focus on the voices of the TB-affected communities, and that must guide the TB response. It is crucial that the lived experience of people is not lost. And coming to the third one, time and again, we have heard communities come back to us and say that we had no idea that this was our right, that we could ask for something like this. This needs to change. A rights-based TB response is still fairly new and we have a huge ground to cover. Being cognizant of that, we also want to set increasing rights literacy among TB-affected communities and was one of our key priorities. Moving on to the next objective. This section particularly learns from the Declaration of Rights of People Affected by TB, launched in 2019, and activating a human rights-based tuberculosis response policy brief 2020. So objective 2 is to strengthen the capacity of the legal community and the private healthcare sector about TB and human rights. A multi-sectoral approach is key. So in that context, working with the legal community becomes an obvious focus. We want the legal community to work in tandem with the TB-affected community. But it is also important to loop in the private sector because there is still, as Ruchika rightly mentioned, and as all of us know, there is still a large population that still seeks care in the private sector. And we acknowledge that engagement with the private sector can sometimes be a bottleneck. Hence, we need to focus on that as well. A legal support mechanism or a redressal mechanism also becomes very, very important because the communities need 2 things. One is to be able to know what their rights are, and the second is to be able to have a redressal or to know where to go if their rights are violated. Moving on to our next objective, to create an enabling environment for a rights-based TB advocacy in the region. We as a group concur that NTPs often have a certain inertia when it comes to a rights-based TB response. So we do not need to reinvent the wheel. What we need is to have integration, and we need the communities to have the space and power to be able to identify the gap and their data to be validated as expert voices. And that is why it is important to invest in, develop, and adopt community-led monitoring tools into national TB strategic information systems. And with the next steps, we again circle back to the idea of a multi-sectoral approach. We need solidarity. We cannot work in silos anymore, and that has to be one of our core focus areas. Moving on to the next objective, which is our last objective for the strategy document. Support the immediate support the immediate adaptation of WHO guidelines into national guidelines and support initiatives in addressing barriers in accessing affordable medicines. Feeding into the right to information and listening to the community demands, we feel that treatment literacy among people affected by TB and TB survivors is a key area for us to focus on. And learning from the Activating a Human Rights TB Response Policy Brief 2020, we as a group also felt that we want to focus on a technologies task force to further all rights, but specifically the right to health. These task force need to look at quick integration of best available TB care tools into the NTP. There is a continued barrier to continued national level barriers for accessing affordable and new drugs. So we aim to work with the NTPs to be able to bridge this gap. But this would just be one prong of a two-pronged approach. The second would be to work with the legal community against wrongful grants of patents. And then the fourth step would be to identify price, intellectual property, and trade barriers to access of different TB tools. Specifically regarding this, we want to engage with trade unions and groups to identify potential impact of bilateral and multilateral treaties on access to medicines. So that brings me to the end of my presentation. These are a few questions that we have put forth for our reactors panel. So I shall leave you with this. Thank you so much.
Thank you so much, Priyanka. Jen, over to you.
Thanks so much, Priyanka and Jeff, for helping us set the background context. And let us then move very quickly into the reactor panel. So now you have heard from, Jeff, who's been directly involved with the project, and Priyanka on behalf of the writing team on the perspective of civil society regarding the advocacy strategy. We have today invited three technical partners, James Millar from Stop TB Partnership, Vinay Bhatia from the Community Engagement, and GER Lee from the WHO Seattle office, and Tahu Islam, the TB and Leprosy Unit Coordinator from the WHO Wipro office, to come and share with us their perspective on pathways in integrating the TB and human rights advocacy strategies. And earlier, I think there were three questions that were projected that we had asked each of the speakers to share their thoughts and to reflect and share their thoughts on today. I'm wondering, Jeff, can we share that slide again, or I can just remind it again? But yeah, that would be really helpful. So we have about 20 minutes, and I would like to then first invite James from WHO, from Stop TB Partnership, to kind of reflect on these three questions. First, what are your thoughts on the regional TB and human rights advocacy strategy? How do you think this advocacy strategy will support the achievement of the TB target in our region? And in what way is this advocacy strategy that it's developed by civil society and TB affected communities aligned with your organization, in this case, Stop TB Partnership's work on TB? And lastly, in what way can Stop TB support the implementation of this advocacy strategy? So let me invite James Millar to take the floor, if that's okay with you. James, over to you.
Thanks so much, Jen. Great to be part of the event today. Really excited to see you, Jen, leading a TB discussion as well. I think how times have changed. Wonderful to have you leading. Big congrats to the team at ACT Asia Pacific and APCASO, to RD, Jeff, Jen and the team, also the ACT AP leadership, Chamrun, LV and others. Really good initiative, and it's the kind of thing I think where we've sort of been going through a process to understand and articulate different roles that civil society and affected community can play globally, regionally, and at the national level. And building those bridges and connections between those different levels is vitally important. And I think seeing all the national partners here today, as well as GCTA and others, it's starting to really take shape. And that's a great sort of thing to take away from this advocacy strategy as a concept without even going into it. And so I think that's an initial point that I'll make. The second area I just wanted to think about a little bit more is around some of the objectives. Like it is really comprehensive, and as Suchika mentioned at the start, it's so good that they're all anchored in the UN high-level meeting targets and commitments. I think that sets it up at the national level to really play an important role as the multi-sectoral accountability frameworks are developed and implemented nationally. And so that's I think really strategic. A couple of areas that I think are important to think about a little bit more and understand, or just more questions, I suppose, for me to understand, is the questions around funding. Because I think that there's a lot of funding and investing in this area of work. I think is something that's a critical advocacy priority there, and maybe it's an overarching kind of theme, but I think it's something that would be really important to bring out a little bit more. And also noting things like the tools, or the call for countries to implement the tools that are available. You know, I note the references from Priyanka's presentation to the stigma assessment, which is great. Also, the various interventions described in the Activating a Human Rights-Based TB Response as well. And I think having this is particularly useful, because I know that the A Deadly Divide report and the calls to action there specifically call for all countries affected by TB, and many of those are the focus, I guess, and have been involved in the development of this, to implement all of those sorts of CRG tools and activities by 2023. So that's something that I think is useful. And the final area around the objective 4, I think it's excellent, but I would also just really encourage, as Luchika mentioned in her early remarks, to make sure that the areas of diagnostics and vaccines are captured there as well. It's probably an easy thing to sort of look to build in, but I think it would be particularly important, noting the stats that Luchika described in her early intervention. On question 2, I think it's very much aligned with the work that Stop TB does. I note that Stop TB is developing a new global plan, the roadmap to sort of end TB, and these CRG focus and priorities that are in this advocacy agenda, I think will feature there. They've been there before, but obviously through the work of you, through all the others who are on this call, the evidence base and the understanding and ideas of how to operationalize human rights in TB has gone a long way over the course of even just the last few years. And so this is something that I think needs to be captured in that new global plan. So I think it's not just that it is very much aligned, but I hope that it can also inform and challenge and continue to push Stop TB going forward as well. So I think that there's things like the new challenge facility for civil society is going to be announced in terms of those who are grantees in the next week or so. And I note that links to the question number 3 around the support. There'll be globally, there's going to be 78 grantees, and I think that there's just over 30 in the Asia Pacific region. And so I think that one of those things for support, and we're very much happy to explore this subject to all the results that come out and that are announced, but I think that there's a real opportunity to try to align all the grantees at national level, regional level, and global level to take forward the key components of this strategy, and obviously those challenge facility grants are very much designed and community rights and gender or human rights focused. And so there's definitely an opportunity to leverage that there. In addition, I note the point around the next global plan. I think that that's also an opportunity to support this and implementing this at that sort of global level, and would encourage you all to contribute your ideas, particularly on human rights, as that new global plan is developed. And then the third and final one, I guess there's in the background, I note the discussion around the Deadly Divide report and the UN high-level meeting targets and commitments. There's an expectation of a new Deadly Divide report will be developed in advance of the next high-level meeting on TB in 2023. And so I would just all encourage you all to be active participants in that, and to utilize both the goals and objectives of this strategy, and also the outcomes that you can achieve by implementing this strategy to help inform that report and really shape the community perspectives that are there. Yeah, final point, just acknowledging the community and civil society leadership in this area, and the coalition and that's come together to do this. And I think that that's excellent, and something that you can all be, just really be really happy about, and provides fantastic foundations for you to build on going forward. I'll leave my comments at that, Jen. Thanks.
Great, thank you so much, James, for those really thoughtful sharing and reflection on behalf of Stop TB Partnership. Let me invite Vinay Bhatia from WHO Seattle office to join us as well. And Vinay, if you could also help respond to these 3 questions as well, that would be appreciated. Thank you so much.
Thank you. And thanks to all colleagues for inviting me and sharing my reactions. And of course, I'll join all colleagues in congratulating APCASO, ACT, AP, and all the partners who have helped develop this document. I think this is an excellent way forward for implementation of TB and human rights, not just in the region, but globally. But okay, let me start with something which we have been doing since the beginning. From the early days when we started talking about the DOTS strategy, and later which moved to Stop TB strategy, and now NTB, we've always talked about, we started with the term patient-centered, then we moved to people-centered. So we always talked about a people-centered approach, but the substance to what constitutes a people-centered approach was lacking. There's no understanding of what would make a medical approach people-centered. And I think this emphasis on human rights fills that important gap. And in last year, GCTA came up with a technical brief, which was launched by WHO DG on activating human rights-based TB approach and this framework. I think they all come together at the right time for giving that necessary push for ending TB across the globe. And of course, will be specific for the region. Now, how would this advocacy strategy support the achievement of TB targets? Well, let's step back and look at what are the issues, broadly. There could be several issues, but I think like if I talk about the Southeast Asia region, there are about close to 1 million missing cases. And that is despite a very good figure, which appears on paper, that there's a 78% coverage in 2019. So what challenges this low coverage, or what leads to the missing TB patients is, one is there is an issue of access, okay? And access gets highlighted in the UN political declaration also. And access just not in terms of the physical distance for which the patients may need to travel, but it's also about the quality of services that they get over there, the human interaction which they face, and the kind of overall ambience that they get, and whether there is a covert or overt stigma and discrimination at the health facility. So all those factors impact the access and probably is a major reason for denying the services to some patients. Specifically, I think for our region, prisons, migrants, they also constitute an important populations. I didn't find a specific reference, but certainly when you do a broader advocacy on the achievement of rights, I think these groups will get included over there. So, improving access for all categories of patients and all the marginalized groups, that would help us reach the TB targets. And the second part is the drivers of TB epidemic. We know poverty and nutrition are major drivers, and these are more so, at least when I talk about the Southeast Asia region. Now, having social protection and protection against the catastrophic costs that patients face would constitute an important human right. And addressing these would actually lead to protection of human rights. And so, inclusion of social protection in all aspects and in the TB care delivery would help in achievement of TB targets. And now this becomes more relevant. We have been talking about COVID-19 pandemic, and that pandemic, we all know, has exacerbated the inequity. It has led to amplification of poverty, of undernutrition. So protection of human rights, and specifically with the tools of social protection, becomes more and more important. Of course, question 2, which you asked about organizations work. So I'll briefly touch upon our regional strategic plan, which we have done for Southeast Asia region, and it would be launched soon. We have had inputs from various community-based organizations. GCTA has been an important partner in reviewing and providing their inputs. And what that has led to is we have talked about human rights in the regional strategic plan. We have talked about community-led initiatives, and we have talked about how we can improve services, talking about quality of services, and that's not just the biomedical approach. So in a way, this advocacy strategy and these documents complement the work that WHO is doing in the Southeast Asia region. And of course, this would be true for other regions as well. We have had long association with communities, and definitely when we come to such forums, we reiterate our commitment to strengthen our engagement with all community organizations. We have, she's not around, but Ms. Paran, who's also member of ACTAPI, and she is a vice chair from Indonesia, vice chair of our RGLC mechanism, which specifically addresses MDR TB. So we have voices over there. Our STAC TB, we had participation of Ms. Blessy, who's there in this meeting, and she was voice of communities in the STAC. And of course, there would be plenty of other opportunities, like when we do the document development, many of the documents which are oriented towards or targeted towards communities, we request our community colleagues to help develop them, so that that actual perspective from the field that is comes into play in the development of these documents. So of course, there would be many more opportunities, and I see that in our region in Nepal, at least one of the community-based organizations has been trained, and definitely we can explore what are the other areas where we could collaborate. As I said, our regional strategic plan lays emphasis on all these aspects. So whatever we do would sort of complement the activities. So those are some of the thoughts from my end, and happy to answer any questions or clarifications if required.
Thank you so much, Vinay. That was really, really insightful. And thanks for sharing the thought with us. Let me then invite our last panel speaker, Tahu Islam from WHO Withdrawal Office, to also share with us his thoughts on these three questions as well. Over to you, Tahu. Thanks.
Thank you very much. Thanks to APCASO and ACT-AP and all the colleagues who are participating today. I'm really glad and honored to be part of this panel. And also, this is probably a good opportunity for me because actually my previous speaker, Vineet, mentioned so well that probably I won't have too much to add. So most of the points Vineet mentioned, I fully agree and acknowledge, and probably very similar for our region too. So my response will be quick. So first of all, I would like to start by saying that, the ethical principles, values, and human rights is the basis of the End TB strategy. And it is really important to address those in all aspects, in all the strategies. And more specifically, this need to be incorporated in the national strategy of any national TB control program. Obviously, all the stakeholders have the responsibility for protecting and promoting human rights. So it's really good to see that you worked on this and the document comes in such a good shape, which is very much in line with the UN HLM target and vision. So with all of those good points, I have 3 points for your consideration. Number one, as I just mentioned, that the human rights or the ethical value is the responsibility of all stakeholders. And if this kind of strategy does not bring all stakeholders together and all stakeholders do not own it, it's going to be very difficult to implement it. So, I mean, I believe that this type of document should be owned by all stakeholders together, including the National TB Program and the other groups who are involved in TB program in the country. Then secondly, there would be difference of the role and responsibilities of the different stakeholders. And I guess that the advocacy strategy could be benefited with highlighting the different roles and responsibilities of the different stakeholders. So that's point number one. Point number two, as we are calling it the advocacy strategy, I believe that we need to have some sort of indicators or monitoring tool to really see that how this helps the country or how it impacts the country. So I believe that a kind of indicators to monitor its utility will give another points to this document. And finally, we always say that, that we are going out of the vertical program approach, and it's very similar, very same for this specific topic too. That obviously TB is related to, we are talking about TB, but there are overall health issues. So I think it needs to be addressed that how this movement link with the overall health and beyond health human rights movement. So that's those are my 3 points for your consideration. Related to our organizational, as we mentioned that as being WHO NTB strategy underpins, or WHO NTB strategy is based on the human rights principle. So from our region, we are having a framework to implement the NTB strategy, which means that the strategy which is based on the human rights. And the framework the foundation of the framework is actually social justice, ethics, and human rights. And we try to look the action domains into 4 categories, which is one is the TB specific, one is the beyond TB but within health, one is beyond health, and the overarching governance. And all of the areas are actually based on this foundation of, as we say, that the social justice, ethics, and human rights. The framework took the approach of the 4 operational modalities, including the system approach, fostering information, strategic communication, and innovation and its rapid uptake. And as we said, that the community engagement and the partnership is one of the major focus of the framework. As our framework matches with the objective of this document very well, I am very much confident that we can work together, and these will be complementary to each other to push the agenda and have it implemented in the countries of the Western Pacific region. I would like to recall our very good collaboration through Jeff, whom we work very closely. And I also would like to remind ourselves of one of the meeting in Seoul, where we actually brought all the community and civil society representative of our regional countries to develop a work plan, and then we followed up for over a year. And I believe that that will be one of the way in future to work together and take this objective into reality. Thank you very much for this opportunity.
Thank you so much, Nalu, for sharing your thoughts with us as well on these 3 important questions. I was hoping that we would have some time for Q&A, but I think in the interest of time, I would like to request that if the 3 speakers could stay with us, and the participants with questions or reactions to what had just been shared, to please leave your comments in the chat box, and we could also have discussions there, and I will be monitoring the chat as well. Later on, we have further time to come back to those. Yeah, I think we're trying to catch up with time a little bit, but we're doing okay. I think now that we have heard from the technical partner, we have gathered some understanding where this project and conversation is coming from. I'd like to turn the floor back over to Jeff to invite our national partners to present the national roadmaps from Nepal, Sri Lanka, and Vietnam before we then move into an open group discussion. Over to you, Jeff.
Thank you so much, Jen. Hello, and hello again, everybody. So just to go back very quickly and use this as a segue for our next session, 3 things that actually struck me with James, Vinette, and Tauhid's inputs and reactions on the strategy is how do we finance the advocacy strategy? And James pretty much, opened some opportunities there, including through the next challenge facility. So that was one of the things that really struck me. The second with Vinette, it was the use of social protection approach as an entry point for opening the discussion on human rights. I think especially with the approach towards private health sector, who are rather unfamiliar with the nomenclature or the terms around human rights, the concepts around human rights, social protection can be one of the areas that can be used as entry points. And with Tauhid, one of the things that struck me was about ownership. How can then this regional advocacy strategy be owned by the stakeholders at the country level, and how can they move forward this advocacy strategy as a multi-collaboration at the country level? And I think this next session will pretty much touch on some of these 3 things that surfaced during the reactors panel. So let me now call on Achyut Sitaula, Executive Director of Trisuli Plus, to share with us after the outcomes of the country level support of the Right to Breathe project in Nepal, what would be the next steps from now on until the following years to come with regards to continuing some of the efforts that you've been conducted in Nepal. Also to mention that some of these national roadmaps that have been developed were developed in consultation with national stakeholders, including NPPs and some technical partners as well. So it would be nice to listen to some of these inputs. So Achut, if you're
Thank you,
ready,
Jeff.
over to you.
Thank you, Jeff. I'm really, I feel really grateful to be part of this regional dialogue, TV and human rights, and thank you, Apkaso, to provide this opportunity, especially for our organization Trishuli Plus, and especially for me. So before I go with my presentation, so I'd like to share some of experiences that Jeff already, explained during his presentation during the Right to Breathe project that we Nepal also part of that project. So before, so it was not long before. I mean, before 2018, there were zero activities, communities, TV community activities in Nepal before 2018. But from the technical support and through other various support from the Apkaso, so Nepal started working. I mean, not working even. So we started talking about TV community mobilization, and then we started working, organizing TV communities. We able to bring TV communities, TV survivors in one forum, in different forum, and then we were able to orient them, and then we were able to orient them and then literate them about they are not just TV patients, but they are more than TV patients. We able to orient and literate them about their human rights and then right to health. And then we had formed some survivor group in some districts. Now we have 12 survivor support group in 12 districts, I think. Then we had series of workshops and training to build their capacity. And then we started engaging TV community in engaging and participating in different TV forum and government TV forum and other private sector TV forum. So Trishuli Plus took that initiation, and then we were able to engage in those forums and meaningfully engage in the process, decision making process. So during this period, so we got lot of support from Apkaso, ACT-AP, and Stop TV partnership. Then so as a result, so we were able to allocate separate seat in the CCM for TV survivors. Now we have one TV survivors in CCM representing TV affected communities. So that was our big achievement. And we not only that, so we able to influence CCM and country proposal writing team. And in 2021 to 24 grand cycle, so we have so many activities like TV community system strengthening, community-led monitoring, and other communities intervention in the mainstream grant, as well as we have C19. We just had submitted and we just had started implementing C19 response mechanism, and in that grant also there are lots of community-led activities, intervention. So we have long way to go, and so journey still continues. So through some consultations, we came up with some roadmaps. There are a lot. I cannot accommodate all of the discussions and those things in the presentation, but some synopsis that I'm going to present. So National TB and Human Rights Roadmap 21 to 23. So goal is a national TB response that respects, protects, and promotes the rights of people affected by tuberculosis in Nepal. So from our consultation, so we came up with 4 main major objectives. So first objective is to expand existing community system, which we already have, able to develop through the, Right to Breathe project and other, Stop TB partnerships, technical support and financial support. So our main objective is to expand those, existing community system which we have already made and strengthen the TB community networks. So milestones will be formation of small survivor group, support group, not only survivors. So we are doing one practice that we are forming a survivor group, comprising with the survivors, TB survivors, and local community health workers from the government people, like TB focal person. So that will be the milestone. And then other milestones, so we are anticipating its acknowledgement from the local stakeholders, engagement in local policy planning and implementation. For that, so we'll have different activities, but mainly specifically we will have support group formation, more support group formation. Now we have 12 support group in 12 districts, but we have 77 districts in Nepal. So we will during this 21 to 23, so we will plan for 77 support survivor support group in 77 districts, and then we will organize workshops and trainings on their rights, what is their rights and literacy, right literacy kind of trainings and workshops. Through these those workshops and trainings will build their capacity and will make them able to speak in front of the stakeholders and the government. So that's how we are anticipating to fulfilling our objective 1. So next slide, Rata. So second objective, so to build human rights literacy among TB affected communities. This objective number 2 has already become a milestone during our Right to Breathe project that was supported from the APCASO, ACT-TB, and Stop TB partnerships. That's why we still are adapting this activity objective. So milestones will be local TB programs, includes public awareness activities on the rights of TB affected by people affected by TB. So activities will remain same, like because we had same activities in the 10 districts during the Right to Breathe project, and we will plan and we are thinking to continuing these activities like formation, and then after Right to Breathe, the manual, rollout of the Right to Breathe manual. So those activities included in the objective number 2. Next, Rata. So another objective is to increase the engagement, participation of TB communities in different, not only the central level, central forums like CCM, National TB Program, forum, not only the national forum, but in the local, entity, local government, because we have 3 layers of government: local government, provincial government, and central governments. So we will have to, engage and participate in the local level, planning and policy planning and decision making for forums also. So we through the lobbying and advocacy events, so we will increase our participation in those forums also. Next. So last but not least, sustainability of communities intervention through local government resources, because the sustainability transitioning and co-financing, like STC is now one of the debating, topics in Nepal also. So we are talking about sustainability after viewing the Global Fund and other donor. So we will have to sustain our TB communities intervention in the country level and local level. So for that, so we will focus on allocation of the domestic resources, not only the central government, but in the local government also. So we will do lobbying and advocacy demonstration, those kind of activities to make our communities intervention sustain beyond the funding. So that is our this is our roadmap. So still there are lot is missing in this presentation, but yeah, I hope so. I am able to capture some of our consultation recommendation. Thank you, Jeff.
Thank you so much, Achut. Let's give a round of applause to Achut. And we are really excited and we look forward to the next 2 years. And it's really good to see that some of the objectives from the regional advocacy strategy is aligned to the national roadmap. It's also quite interesting to see how interlinked the community mobilization, and which now is expanding from 10 to 77 districts, and also the discussion on human rights. So really good to see that there, and also the financing aspect of it, which could be an entry point to continue human rights-based related activities in the TB response. So congrats on that. Next up, we have from Papua New Guinea. Let me call on Leslie Bola from the TB Advocacy Consortium, and also Meredith Tutumang from the Burnett Institute. So Leslie and Meredith, over to you.
Good afternoon, everyone. So the KP Consortium is an advocacy organization that's doing HIV, and now we're venturing into the TB work. We are the voices of communities in Papua New Guinea, where there's accountability to each other. We're accountable to the government, to our partners, but a gap area that we have is having a voice from the communities so that we can improve in our quality of services. So one of the partners I have here with me is Meredith Tutumang. She works with Burnett, and they also are recipients of sub-recipients from Global Fund and also DFAT who are doing TB work in the community. So Meredith has been supporting us in our advocacy strategy, and she's going to help me present our roadmap work. Next. So over to you, Meredith.
Thank you, Leslie, and thank you to all the participants in the meeting today. So basically for Papua New Guinea and for the KP Consortium, what the consortium did was sit down and basically talk about who they would like to involve in the TB work, to basically look at how they generate information to help them with advocating for the services that are needed for the key populations. So in June, what Leslie and the Advocacy Consortium did was they invited a number of participants from the community. So the people that they invited were basically key populations. That is, they looked at survivors, TB service survivors, people who did treatment and survived the process, or basically passed the process in terms of their treatment. There were people with sexual diversity who were also included, people with disability, people with HIV, and young people who participated in the discussions. So in the first instance, when the group got together in June, what we did was basically discuss the services that were available in the community. So we looked at keywords that was how the community was able to access services that were in their catchment area or the living area. Secondly, they looked at the availability of resources that were available within the facilities that they went to, which is they looked at the treatment plus the testing products. which basically aided diagnosis and the treatment support. The other activity, the other key theme that they looked at was affordability, because sometimes when in their experience, the community said that when resources were not provided, they were asked to pay fees. So discussions were made around, what people or what the community could afford and what they couldn't afford at the time. And then most importantly, in the discussions, they looked at the quality of service in relation to testing and diagnosis, plus the quality of services in the treatment that a patient would receive, or the community on treatment would receive during the course of their treatment. So what the group or the KP Consortium and the facilitators also did was they looked at having these discussions with 3 provinces. So they started the process with, we started the process with Port Moresby, which is the National Capital District, capital city of PNG. And then we looked at the Highlands province, which is Eastern Highlands. And Eastern Highlands is a focal point to 6 other Highlands provinces. And then Morobe province, which has like the one of the 2nd largest population grouping in the country. And also we looked at sort of the burden, TB burden. In part of the discussions, when we had the discussions with the Port Moresby and the Goroka team, where after all the sort of discussions around the situations and experience that each of the participants sort of experienced, they all thought that it would have been important that we come up with a very basic tool that they could use in their grouping in those respective provinces, so they are able to collect information. So what we did was they themselves, the community themselves, designed a scorecard which basically indicated the 4 key areas that they wanted to collect information, which was, again, accessibility, availability, affordability, and quality of testing and treatment. So in June, July, and August, the TB community group started this information collection process in the 3 respective provinces. Now, before they started the information collection process, the card that they developed was basically checked by the National Strategic Information Committee, which is the sub-technical committee that supports the HIV platform. And also we have members that work across both TB and HIV. So the information was checked to ensure that the key themes or the key indicators that the community was checking in their scorecard was aligned to the national indicators, just so that the community is also taking ownership of responding to TB in the community, collecting information, communicating their needs, and advocating upwards, so that they're also contributing to the national indicators as a community group. So the result, some of the information they have collected, especially for National Capital District and Eastern Highlands, have already been entered. They have actually been trained to collect the data themselves, add on to a basic tally, process that, and they've sent it to the KP Consortium, who've now worked with the strategic information subcommittee to do an analysis for them. So I think for September, October, November, December, and next year, you would see the roadmap of the continuous work that the KP Consortium would like to do. So for September, they would continue to do collect information, analyze, and share at the technical working groups for discussions. And the platforms that we are already using is the TB HIV Technical Working Group national level and the Global Fund country coordinating mechanism. Plus, at each of the respective provinces, we'll be using what they call the PHA committees or the provincial health authority committees to convey or to share the results. I think one of the things that we also discussed was as part of the advocacy process, and in terms of after all the information was collected, the group will be working with the facility to convey message, to look at gaps, and to continue to communicate with the facility to ensure that services were readily, quality of services were readily available, including the products that were available for survivors or people on treatment. So they are able to access treatment and the commodities they need. Another thing that we also discussed was that if facilities were not able to support, then they would accelerate higher to the different advocacy platforms that we have in country. Leslie, I'll leave the other discussions to you. Thank you.
Just the next slide, Jeff. So with the process we've done so far, I just want to highlight 1 or 2, 3 points. So that the concept about community-led monitoring for us is very important because it to avoid confusion with the communities, it's a new concept. So we really need to explain to our participants and also the service providers, because one thing we found out was it was like a threat from the health clinic. So there was lots of consultations that went to and fro with the facility and also the community. So everyone understood what it meant and what was the goal of that. Secondly, in Papua New Guinea, illiteracy is very high in our country. So storytelling is a very important tool that Meredith and I and 2 other facilitators got people to tell their stories. It's a very simple storytelling, but we got more information through that. So that's a cultural element, but it's a strength that we use. So there's issues around with the scorecards. We really wanted to be consistent with our indicators, national indicators, so we're all speaking the same language. And it was important for us to involve the Department of Health. And for us, the Advocacy Consortium, we are filling in a gap. We have a very challenging health system, but we are there to support the health system so it works for both sides. So those are just some of the learning points we've learned so far. And it has really helped us to excel with our advocacy program around TB. Next. Just want to share some of the photographs of people who have been involved and how we are creating our work in Papua New Guinea. And some of you who have worked in PNG, you would recognize some of these people, but these are the hardworking communities that they are crying out through data that they want us to support, but we are coming through advocacy. Okay, with that, thank you so much. I just want to thank Meredith for helping me as well. So over to you, Jeff. Thank you and the team.
Thank you so much, Leslie, and thanks, Meredith, for the presentation. It's really good to see that some of the activities in the regional strategies reflected in the national roadmap that you developed. And I truly believe that stakeholder-led and monitoring and mobilizing communities to lead the monitoring is actually a way to own the response and the programs that the country is implementing. And I also saw that continuously across the roadmap that there's engagement with different partners and that you continue to engage with partners. Something that Tauhid was saying in terms of owning the strategy and owning the rights-based approach to TB at the national level. So thank you so much. Thank you so much for that. And again, we look forward to what's going to happen in the near future from the outcomes of this project moving forward. Last but not the least, we have from Vietnam, Vu Ngoc Hoa, Communications and Social Mobilization Manager from SCDI.
Yes.
Hoa, over to you.
Yes. Wait a minute. You can, everyone can see my screen now, right?
Yes.
Yeah. Good afternoon, everyone, friends and colleagues. Thank you, my colleagues in Nepal and Papua New Guinea. I learned a lot from your roadmap and also your work in the Right to Breathe project, especially in the monitoring sharing from the last presentation. So as Jeff already mentioned that in Vietnam that we particularly in the Right to Breathe project that we choose the entry points as to increase the public awareness of TB and the CRG related issue to TB as the entry point. I want to share with you some information about the context and the current situation of the TB and CRG related issues in Vietnam. So in public that in general that we can see that the awareness and the concern about TB and the human rights TB related issue is very low. Most of the people in the community, they think that TB is some disease in the past, that no one have TB anymore, and it's very rare in the community, but it's not. In terms of the community here, I want to mention about the community-based organization. We have some survey to assess the capacity of the community in terms to roll out the activities of communications and also advocacy in terms of TB and also the human rights activities. And we see that normally that they have, because that the community, the CBO that are now working with SCDI in TB activities, they have a long years, more than 10 years experience working in the HIV response. So they are very experienced. They receive quite a lot of capacity building, but there we identify a gap in their capacity is that they lack the capacity to translate the evidence, the case, the HR, the human rights violation case into conversational stories, and they lack the capacity to engage with the media or engage with the public community. So that all the message, the stories is sharing within the community quite a lot regularly, but it's not exposed to the public society. So we identify it's a gap. For the national TB program, we are working with the national TB program now more than, I think, 5 or 6 years. And at first that they don't recognize the role of the community in the TB response, but gradually that we changed their mind and they start recognizing the role and the effectiveness of the TB affected communities involved in the response. But they not yet include any component to promote the human rights of the TB patients or the TB affected communities in their official program. And the next level that starting from last year or 2 years ago, we're working with the local TB programs, and also in every province and city in Vietnam, we have the NTB committees that they supposed to commit to realize the NTB agenda by 2030. But we also realize that they don't have much, they don't have budget, and they don't have any coordination mechanism with different stakeholders in their local area. So everything stay idle. So we think that now it's time that we need to wake them up, and we need to facilitate to help them to do their job. So in order to in our roadmap TB human rights from 2021 and until the end of 2023, that we define 3 main objectives, because that as you can see that in the writing team already shared, the advocacy strategy is very complex and cover a lot of things. But in the time frame of 3 years, that we need to sacrifice some of the objectives, and we select what are most feasible, and considering the financing and also our considering our resources. And the first one is that we focus on building the capacity for the communities and their community-based organizations in TB response and in CRG, in advocacy, in communications. The second objective is that we are working with the provincial TB programs and NTB committees at local level to also build their capacity, not just in how to increase their coordination capacity, but also improve their capacity in CRG and how to incorporate in the TB response at local level. And the third objective here is that we really want to engage the media and the press through the work of TB affected communities, so they pay more attention. The media, the public media and press, they pay more attention to the TB story. Yes. So the four forces or four target group in our roadmap. One is the community-based organization of TB affected communities. The second group is the TB programs at both national and local level. And the third one is organization supporting TB affected community, like we as CDI, we are the supporters for the movement on the work of the TB affected communities, but we need more organization to join the force. And the fourth force is the media and the press. Next. So this is the roadmap of the. So based on the three objectives that we break down into steps and activities, and some of the activities that here that we already cover and implemented in the Right to Breathe project, we start the project quite late, and unfortunately it fell into the fourth wave of COVID-19 in Vietnam. So most of the activities that we need to do it online. We do the training online, we do the interview online, everything online. So I feel very jealous with my friends in Papua New Guinea when they can show a very nice picture. I miss the kind of physical workshop and training with people. So I think that clearly here in the slide that you can see all the activities. Not much. We have total 9 groups of activities. So it's also respectively with the objective and also the force that I already mentioned in the previous slide. And for considering all the activities that now we think that we can be confident with around 80% of the financial secure for the project, because that is also in line with aligned with the next coming projects that SCDI and the communities will implement in the next 2 years. So I think that I just have 7 minutes for all the roadmap. Jeff will share with you the presentation and roadmap afterwards. So I think that if you have time, that we're very happy that you can give comments and your experience. But the last but not least slide, I want to share with you the one of the results that we do in the Right to Breathe project, and which we want to continue in the next next phase, next period, is that to build the capacity of the community in order to translate the story in terms to engage with the public, society, the media, the government. So so I also sent Jeff the full version of the story. So this story is written by a CBO TV serial leaders in Bến Tre. Bến Tre is a southern province in Vietnam. So she's been working with SCDI for 10 years mostly in HIV response, but she's very active in supporting TB affected community and TB patients. So when we select her, when she enrolled in our writing workshop, we have a 6 session of writing and mentoring workshop with a journalist. And in the first class of our writing workshop, she, when we asked about what kind of story you want to tell people about your clients, about your some of the TB survivors that you know, or about some of the TB issues that you know, that she tells us the story of Thanh, that in the character. And she writes a very short story about 200 words. But after 6 sessions, no, it's 3 sessions because we have 2 groups, and she can by herself develop a story, a very fascinating story, very interesting and informative story about the same character, the same storyline. And not just about that, we can lengthen the length of the story into more than 1,000 words. But I think that it includes a lot information about the human rights of the TB communities and TB survivors. And we pick a name for these stories, aftershocks of being a TB survivors. So so you can read here the character here named Thanh, and he has an unhappy life because that his parents got divorced, and still until now, when he's really grow up, it still bring like trauma for him, like from his parent divorce. So and he had TB, and like having the trauma from his parent divorce, that the TB disease that bring him a lot of aftershocks, because that he definitely lost his ability to hear, the ability to hearing. So even now that he no more have the TB, that he's cured completely, but he has to live with the disability of hearing like forever, for the rest of his life. So it's just one aspect in the human rights and other issues around the TB response, around our community in the TB. So I think that with this project, the Right to Breathe project, that we found very lucky that we have a chance to wake up the potentials of the community to tell the story. Like one of my colleagues tell that they have the ability to tell story. The storytelling is very powerful, and the reason why that we choose to enhance their writing capacity, because writing is very easy. It requires no equipment. You just need like a head and a heart to think about your friends in the community, and you can write it. But of course, that if we give them the chance to enhance their capacity, so they can really bring that into a good story that we can use, we can share with many people, and we can use it to attract the attention of the public. So I think that's this is what I want to share with all of you in what we are doing in Vietnam. But I wish that I had more time, because that my section of project is just a part that SCDI is doing. We have another pilot of project mainly on the intervention and working with the health settings. So with a lot of things that we want to share, but due to the limit of time. So thank you everyone for listening.
Thank you so much for sharing this very enlightening story and also the roadmap that you developed together with partners. Vinette earlier mentioned about accessibility and also social protection as an entry point for human rights discussions. And I think what you are doing in Vietnam, although Vietnam is not technically part of the Siaro region, what you are doing in terms of integrating the cost and impact of TB into the lives of people affected by TB and TB survivors is very important to highlight how human rights can be operationalized into our daily lives, not just a concept that's sometimes very difficult to advocate at the national level. So thank you very much for this. And thank you also for understanding the limit of time as well. But we do look forward to what's going to happen in Vietnam through SCDI's leadership. So as mentioned, we did hear from the three countries how the regional advocacy strategy on TB and human rights will be translated into national roadmaps. And it's really nice to see from the three countries, namely Nepal, Papua New Guinea, and Vietnam, how they will move forward the advocacy and through the different activities that they mentioned in the roadmaps, this agenda of integrating human rights within the TB response. And this is not the end, at least, well, this is the end of this project, but this is definitely not the end of our collective commitment to ensure that the TB response in Asia and the Pacific will be inclusive and will protect, promote, and fulfill human rights commitments as a whole, in particular of TB-affected communities and of civil society as well as we participate in the TB response. Unfortunately, we don't have time for question and answers and comments, but I would like to request everybody to use the chat to provide their comments. If you have any questions, just mention who you are asking the question for so that we can address them on the chat, and so that the person you are putting the question to can respond to your questions. So please use the chat for the comments and the questions. So at this point, I'd like to ask everybody, since we're gearing towards the end of our regional dialogue, if you can all open your cameras as we go through one of the very, very important part of any webinar online, which is doing on Zoom, is to take photos of all your beautiful faces. So please put on your very best smile. We're 8 minutes towards the time. So a little bit of a sigh and a relief, and hopefully that you listen to all the insights and the inputs and the feedback. So I'm gonna start taking photos. When I say 1, 2, 3 and then NTB, everybody can say NTB so that I can take your most beautiful faces and post it online on our Facebook page, not just on any online. All right, 1, 2, 3, NTB. Okay, one more, 1, 2, 3, NTB. All right, thank you so much, everybody. All right, you can turn off your videos now if you prefer. We still have 7 minutes, so unless there's any burning questions at this point or general comments on the presentations from the very beginning, the reactors panel, and the presentation of the national roadmaps. Any comments or questions? Please raise your hand using the raise hand button. Going once, going twice. I don't see any hands. So it's either that you appreciated all the presentations and you had many insights in terms of the presentations that were made by our different partners, including technical partners with WHO and Stop TB Partnership. Or you went out for coffee. No, I'm just kidding. All right. So I guess no more comments. Again, thank you very much, everybody, for staying with us for the past 2 hours, for listening in, and for the presenters again in presenting their national roadmaps. I'd like to end this webinar by calling our executive director again for our closing remarks. So RD, please take it away, and thanks again, everybody, for staying. RD.
Thanks, Jeff, and I'll try to keep this short. I think first off, just to acknowledge that while this may be the end of this phase of the Right to Breathe project, as Jeff has mentioned and as others have alluded in their presentations, this is definitely not the end of where the advocacy strategy will be in terms of implementing. So it's very heartening to see that Treasury Plus, SCDI, and the KP Advocacy Consortium would be able to implement elements of the advocacy strategy at the country level outside of the CFCS grants, because SCDI, KP Consortium, and Treasury Plus are their own autonomous community and civil society organizations, aside from just being CFCS grantees. Aside from that, we're also seeing opportunities in terms of APCASO and Asia Pacific's own funded programs with the Global Fund on Community Rights and Gender Strategic Initiative for TB. So we'll find ways to weave in the implementation of the strategy in that funded grant that is ongoing until December 2023. Definitely, as ACT Asia Pacific, we would consider the advocacy strategy as an adopted guidance document in the work that we do and in the work that we'll be supporting with country partners. APCASO, if needed, is also committed to even investing its own core funds investment for catalytic initiatives in the region, just to be able to support and make sure that we don't end with a strategy document that does not get implemented. And then last but not least, we are really looking forward to the 10th round of CFCS successful grantees announcement. It's going to come out soon. There would be a lot of CFCS round 10 grantees from the region, country level, as well as regional, and we're looking forward to working with the counterpart organizations from Asia Pacific to incorporate elements of our advocacy strategy. So, I mean, again, this is the end, but at the same time, a beginning. We're really feeling happy at the end of APCASO as well as ACT Asia Pacific. I think before ending, I would be remiss if I don't acknowledge a few groups and people. I would actually encourage everyone to turn on your microphone so you can clap with me as I acknowledge the groups that are behind the heart and soul of the Rights to Breathe project. Of course, first and foremost, I think they needed to leave earlier, but really acknowledgement and thanks and gratitude to the Stop TB Partnership for putting their money where their mouth is on community empowerment and community rights and gender issues. We're really grateful that Stop TB is investing money and it's really trying to consolidate further funding for community rights and gender. The fact that this project got funded is a testimony to the effectiveness of Stop TB in mobilizing resources for community rights and gender. So acknowledgement to Stop TB. Of course, our amazing country partners, Treasury Plus Nepal, KP Advocacy Consortium in PNG, SCDI in Vietnam. Congratulations for the amazing work done despite the difficult circumstances, including due to COVID. And then, of course, and last but not the least, to Jeff Akaba from Team APCASO and ACT Asia Pacific for the wonderful work leading this project and providing a lot of the heart and energy and supporting the country partners as well. Nothing but pride and happiness on the side of APCASO, and gratitude to all our partners beyond the 3 projects. We look forward to continuing working with you and advancing the rights of TB affected communities. Thanks everybody. Have a good day. Keep safe, and definitely we'll keep in touch.
Thank you, Artie. Thanks, everyone. We're 1 minute before time. Congrats.
Congratulations.
Congratulations,
If this was in
everyone.
person, we would be drinking and we would be celebrating and eating.
Yes, I miss even physical contact. Miss some physical hug here. Okay, stay safe, everyone.
Stay safe.
Stay safe.
Yeah.
Thanks for sharing that story, Hua. Looking
Yeah,
forward to
we
the other
still have a
stories.
lot. We are finalizing I think up to 10 stories. So I think that
Amazing.
yes, we are
amazing.
going to
That's
sharing
excellent.
with you
Yeah.
very soon.
We'll be happy to publish that in APCASO.
Yes,
for you.
and we will share as well all the presentations.
It's a pity that we cannot travel to
I
provinces, so we cannot
know, I know.
go. So it affects like I don't know, 40% of the quality of the article.
Yeah, but let's see